All right, so this is April 27th, Monday evening, and you are joining us for Hot Topics with Supervisor Jane Parker. We are recording live as well as live streaming to Facebook. We'll take questions both on Facebook and in the chat, and we'll go ahead and post this recording to Jane's YouTube account tomorrow. So if you miss us, come and check it out later. All right, Jane, I'm passing it off to you.
Thank you, Wendy. Welcome, everyone. Really appreciate you being here and exploring with us how we are doing with this shelter in place and the COVID situation. And I want to just a couple of things before we get started, reminding people to keep your device on mute. Unless you're actually speaking. And then if any of you have questions, comments that come up between these hot topics and you want to ask me or ask my staff any questions, we are on duty. So you can reach us through the main telephone line that rings directly through to us, and that number is 883-7570. And you can also contact us through our through email and just send any message to District 4, that's the number 4, at co.monterey.ca.us. And so tonight we are going to just be talking about some of the more recent developments in the virus planning. So wanted to just give you an update on a few things. I'd also like to hear from you either through messages, or if you're in the Zoom meeting, if you want to raise your hand. I am interested in things that you are finding to be particularly helpful to you to keep yourself on an emotional even keel and healthy and safe during this really unusual time. So just a few things I want to let you know about. Last week we talked about the alternate care site that is being developed out at the Marina Airport, and that is proceeding. And as we mentioned last week, that the structure itself will be turned over to the county this next weekend, and then the county people will get it ready for occupancy, but it won't get activated unless and until all of the hospitals that we have in the county find that their capacity to care for patients is completely exhausted. So all 4 hospitals in the county, Me Memorial, Natividad, Salinas Valley Memorial, and the community hospital, would all have to have their surge capacity, their beds be full before the Marina site would get started. On the other hand, we are also have been planning for and are ready to go live this week with some housing sites around the county. The first one that is going to be ready for prime time is at the Monterey County Fairgrounds, and I think members of the media were invited on a tour there today, so you may be seeing images of the way that the space has been partitioned to give people some privacy and help them recover from the virus. In addition to the Monterey Fairgrounds, there is a location in Salinas being looked at, and 2 in the city of King City. So the idea is to have people be able to go to a place that is relatively close to where they normally live and shop. And not that they'll be doing a lot of running around, because these care sites or housing sites are for people who live in crowded conditions at home, where they are not able to completely isolate. And this is for people who have been tested and who have been shown to be positive for the virus. So this, the fairgrounds, the location in Salinas and the locations in King City will be places where they will be allowed to go, and then they won't be allowed to leave again until they are completely recovered from the virus. And the members of the public are not allowed to come in. So the idea is to make it, give them all the care that they need to recover, and to keep the general public safe from infection. While those have been in the planning stages, we have also had locations in motels mainly, where people could sequester if they needed to, either if someone in their family or living arrangement tested positive and they needed to quarantine themselves, or if they themselves were positive. These are people who live either in many people to an apartment or to a house where the person who's positive doesn't have the opportunity to have their own separate room and their own separate bathroom. So this could be farm workers who often live many people to a home or a unit. It could be people who are currently not sheltered and live with a group and want to be able to keep their friends, family, acquaintances free from infection. So let's see, it looks like there is a question. As we come up to the renewal of the county shelter-in-place order, are there going to be any changes? I work as a maintenance person in a private school. In the first shelter-in-place, I was able to work preserving the assets of the school. The second order decreed that only certain things could be worked on. Can the county shelter-in-place order be returned to the original verbiage? That's a good question, and it actually segues us into another topic area that I wanted to bring up. First of all, the County of Monterey health officer is working together with the state health officials and other county health officers to determine the right timing, the right conditions for any changes in the shelter-in-place order. For now, the only thing I'm aware of is that there will be a requirement that when you go out and you might come into contact with other people, that you be wearing face covering. This can be in the form of a bandana, a converted t-shirt, or any other cloth mask. You can use the disposable, largely paper ones, but it's actually preferable, if you can, to use something that you can use, wash, and grab another similar one while the ones that you've been using are in the laundry. That's the only change of any kind I'm aware of that's on the near horizon. But there are a couple of things we know about what seems to be being looked at for any changes in the shelter-in-place order. We know that the governor has laid out 6 conditions that will influence the timing of any easing of the shelter-in-place order. And they have to do with, I'm going to look at my notes because they all make perfect sense, but I can't remember them all. One of the indicators has to do with testing and monitoring of people who are COVID positive. And I actually have some news on that that I can share. The other indicator is how thoroughly counties and the state broadly can prevent infection. So what are the strategies that are in place that can make sure that we don't have an undue level of transmission? Third indicator is, are the hospitals able to accommodate any surge in virus positive patients who may need hospitalization? Are there, the fourth one is, are there treatments or a vaccine available? A vaccine is probably a longer term goal, but treatments may be on the horizon a little sooner. The fifth indicator is the ability of institutions or businesses or individuals to maintain social distancing. So this gets to the questioner's question about whether they might be able to return to do maintenance and repair work at schools. If they're, I don't know the timing, but one of the things that would be looked at would be, is there a way for you to do that work in such a way that you and any other people working in the in that location can keep 6 feet apart, probably wearing face covering to make sure that all those protocols to minimize possible infection are in place. And the sixth indicator is a set of criteria and plans for reinstating a shelter in place if that proves necessary. If as we relax the rules and people are maybe not complying, or if those if it's not working and there's a spike in transmission, we might need to go back into a more severe shelter in place. Or it could be also that just as we get to flu season, there may be enough other things going on, or maybe another surge in the disease. We don't know. But those are the 6 areas that need to have a certain level of competence and capability for there to be a consideration for opening up the rules on shelter in place. And along those lines, I would say that some of the good news that we got in the last several days is that at the state level, and you may have heard about this, that at the state level, they are proposing 80 testing sites to be scattered throughout the state of California, and they are being placed in areas where because of the potential sort of the risk of the population concentration, various socioeconomic factors, and lack of access to existing testing in the community, if a number of those conditions exist, that would determine that one of these testing sites might be a good fit in an area. And it looks as though Monterey County will be receiving 2 of those testing sites. So that's good news for our residents. They will be located tentatively right now. The locations being looked at are in the city of Salinas, in the Alisal area, which is a high density population, and then also in Greenfield, because in South County there may be limited access to testing options available to people. And it also is, both of those cities are areas where there's a pretty significant population of farm workers who are considered essential workers, and they are out there working in the fields to help get us food, which I'm all for. So it's good news that we're going to have these testing sites. They will be able to, they'll do their own, they'll take the specimens there, they will send the specimens to a lab, and they're supposed to be able to get results within 24 hours. So that should be pretty prompt. And from what I understand, each location, each site will be able to administer about 130 tests each day. So that will really increase the number of tests available to us in the county. Also, those testing sites can be moved. So if after some period of time, several weeks, say, there just isn't as much demand, or we find that there might be another area with a greater need, the site can be moved and allow for another community to have access to those tests. So that is, it's good news because you know, testing helps us know more. It's also good news because that is one of the governor's indicators for whether we can relax some of the standards or change some of the standards in the shelter-in-place order. So on the cautionary side, I would say that, of course, if I go and I get a test and it comes back negative, that's good for me. And it really only means that that day I do not have the virus. So it's no guarantee that I won't get it in the future. And so it's just, it's one of those things where it might give me kind of a false sense of security, like, yeah, I got tested, I don't have it. But you know, if I can get it at any time, I still have to take precautions. So anyway, it's going to be useful, but it's not going to be the answer to all of our prayers, I'm afraid. Let's see, what else? Let's see. Oh, the other thing I guess I can talk a little bit about is just the question about whether we can, depending on your job, whether you'd be able to go back and do it. A number of industry groups, sectors of the economy are looking at what their protocols might be. And one thing that we can be pretty sure of is that for probably an extended period of time, until there's a vaccine, really, we will probably have to practice the physical distancing that we're now becoming accustomed to. We will probably have to wear face coverings when we go out, and we might interact with someone who is not in our family unit or our housing unit. So businesses and schools and you know, all kinds of folks are looking at, that's probably going to be the basic, those are going to be the basic ground rules for being able to resume some level of activity. So they are looking very carefully at how that might work in their sector, in their, you know, business area. So, you know, if a construction site, for instance, was going to open up and continue working, they would have to demonstrate that they have surefire ways to maintain the social distancing, that they would require face coverings, that they would have adequate places for people to wash their hands, and all those kinds of criteria and guidelines. But that kind of planning and thinking is going on now, certainly in our county. I imagine it's happening all over the state. And one thing that I did hear from our health department director today is that it appears that instead of talking about essential businesses and non-essential functions, that the criteria really is going to be based on sort of risk of infection. So to the extent that you, in doing your work, can maintain physical distancing and keep yourself and others safe from infection, those business activities, those work activities may be part of the changes in the shelter in place, rather than trying to say, oh, your work is essential and you over there, yours isn't. It'll be much more related to being able to prevent transmission of the disease. Let's see, question from Facebook. Are masks required now? Most people aren't wearing masks here in South Salinas. I don't think there is a requirement now for when you go out. I know that when some grocery stores do ask that you wear face covering when you come in, but the health officer is working on an order to make face coverings required, and that will be out in the next few days. So get ready, start making your masks, and finding all those bandanas that you haven't worn in 15 years or whatever. They're very handy right about now. I have them in the most amazing colors. Okay, let's see. David Beck has posted questions at the bottom of some page that I can't see. So if someone can get me those questions, that would be great. Can you expand on how the County of Monterey anticipates 33,000 total cases by the 4th of June, as shown on the 70% compliance shelter in place graph from the presentation shared by the health officer recently? This would mean that Monterey County would need to average 863 per day for the next 38 days, including today. Is the graph just wrong, or are there data points that aren't being released as of yet by the health officer? Oh, great, that's from David Mack, perfect. Yes, so the health officer put out a graph that showed kind of a big blue hump of like 230,000 cases if we hadn't had the shelter in place order, and then various other curves getting lower with higher compliance to the shelter in place order. And it was what it showed was that the surge, the peak, would come probably at the end of May, early part of June, and at that time about 33,000 people in Monterey County might be infected. So it's and I know that they're looking at this information. The modeling is not perfect, so I know they're looking at this all the time, and it does seem that the numbers are low, and that we may not meet that level of infection. But it's hard to say. I don't exactly know how pandemics go, but what we'll be watching is the progression of the disease. Right now we have about 175 cases. They say that for every case that we have tested and that's come back positive, there are between 35 and 55 more people who are positive, but who we don't know about, because right now we're only testing people who show symptoms. So that's on the screen now. You'll see the graph that the questioner was asking about, and it shows with 70, the yellow low hump shows that's if we are 70% compliant with the shelter-in-place order. We could possibly have 33,000 cases, and we may, as I say, we may get there. The way that when I asked a very similar question to this last week or sometime, the health officer said that actually, rather than trying to imagine the number of cases, because of that multiplier effect that we probably will never know the full number of people who are infected, that we would look at hospitalizations, and a matching graph to that showed that at that peak, if there were 33,000 people infected, that we might have about 900 hospitalizations. And that's that also seems high based on the number of hospitalizations we have had so far. I think we've had 30 so far. So it may be that we are being successful enough in the shelter in place that our numbers will remain low. So that's the kind of thing that the health officer is monitoring and kind of applying that to what they know and understand about how pandemics work. So right now, what we can say about the shelter-in-place order, in addition to the fact that it's changed our lives a great deal, is that it is working. The number of cases is quite low, and that's the goal. So I don't know how the numbers will end up, but so far we are being compliant with the shelter-in-place order, and it's working. Let's see. Here's someone else saying, okay, I tried getting the antibody test twice at Natividad and Monterey off York Road. No luck. Everyone seems confused. I was in Wuhan in October. In January, I was diagnosed with bronchial pneumonia. Later came down with a fever. I thought it prudent to test for antibodies, but so far no interest in anyone I've seen yet. So that's interesting. I didn't realize, so I had heard that the antibody test was available in that location off of York Road, as the person refers to. I don't know why. I mean, I've heard it from several sources, many of whom are reliable. So this is the first I've heard that doesn't seem to be a possibility. So, and it sounds like you may have some antibodies. So interesting. I'm sorry to hear that's not working out. Let's see. So someone from Facebook is saying Saturday morning, some fools are planning a rally at Star Market. So I am certainly, rallies are not compliant with the shelter-in-place order, and other people have raised questions about what to do when they are aware of people gathering in unsafe ways, such as that. And that would be something that it's recommended that you call the sheriff's office or the police department in the town where it's happening. It's not considered an emergency, so you would use the non-emergency number. But I know that law enforcement does enforce the shelter-in-place order if they know about a violation taking place. So I would recommend staying tuned and definitely reaching out to the sheriff's office or to the Salinas Police Department if that really appears to be happening. So, oh, and here's something. Yes, I don't think a rally is necessarily a violation if people keep their distance. That's true. If they're wearing their face coverings and they're 6 feet apart from each other, that would be probably okie dokie. Let's see. One thing I was hoping people might want to chime in on is whether you or what kinds of things you found to be helpful to kind of get you through the day, get you through these weeks of sheltering in place, ways to stay sane, keep yourself healthy. I would just say that for myself, I have whole routines that I do. Try to get good sleep. I try to eat well. I try to do meditation when I can. I try to get out for a walk most days. But I have found that in addition to all of those things, one extra thing that has been really helpful for me is to make at least one phone call. 2 is better, but one phone call and have a conversation with a friend, or actually it doesn't have to be a phone call. I've talked to my neighbors across the street, with the street between us, just a conversation about how people are doing, the weather, what projects they're doing in their house, or anything, helpful, or, any suggestions. I just find being able to connect with people really helps me keep from getting too off kilter. So I'd be curious if there are things that any of you have found that are helpful to that you've found to add into your routines to keep you keep you on an even keel. Let's see, anything else on the virus? Here's a suggestion that, there are a lot of people in our communities who are independent operators, small businesses, very small, who may do the kinds of work that do happen within the 6-foot distance and may not be able to resume their work as soon as some others. And so for them and for any of you who are really suffering from a lack of paycheck, who have needs, who may not have health care for some reason, may not be able to afford it or qualify. I really encourage you to reach out and find what assistance might be available to you. The State Economic Development Department is a really great source for unemployment insurance. You can go to a website called See for Yourself. It's the letter C, the number 4, and then the word yourself, seeforyourself.com. It's an easy way to apply for public assistance. And I'm not sure, but maybe Wendy, you can help me with this. Do you know if people say want to see if they qualify for food stamps or Medi-Cal at this point? Would they look for that through See for Yourself? I'm not sure. We will find out.
Yep, this is Wendy. I'm here.
There you are.
I'm going to share my screen so you could see the See for Yourself website, but I'm
you're going to do even better than.
So yeah, See for Yourself is a great tool where people can apply for cash assistance if you have very low income. If you need food or nutrition services, you can apply for food or nutrition services. Also for Medi-Cal, if you need to have access to Medi-Cal, you just go online, see the number. Is that popping up now?
There you go. Yes. See for yourself. There it is.
Or the word yourself.com. You can start an application online, and someone from our county eligibility team will follow up with you to get any additional information that they need. And I do think it's important too to realize that the County of Monterey has a ton of essential workers who continue to man the call center and process applications for things like the CalFresh program for Medi-Cal. I know the state of California, the EDD Center is reassigning hundreds of state employees to help process unemployment applications. And the county continues to process all of the applications that come in for public assistance. So this is a great way for anyone who may be sitting in line at a food bank. Our food bank went from providing services to about a quarter, 20% of our population, to providing food, basic nutrition services to over half of our residents in Monterey County. So for anyone that's worried about having enough to eat, this is a great, it's a great service, and it's here, and it's administered by the county. So I encourage you to check it out and then learn more.
Yeah, I think a lot of people who it would never occur to them to look for public assistance may be in a position now to really benefit from food, from healthcare, cash assistance. I mean, it's there for these kinds of situations where there's just nowhere else to turn. And this is, for some people, this economic impact, it may last for quite a while. So really, I really encourage you to reach out and get the help that you need. There was a question for who is in charge of testing. So right now, testing is mainly administered through hospitals because there's a very particular swabbing technique to get the specimen that then gets sent to the laboratory. So if you want to be tested, if you have symptoms and you're concerned you might have the virus, you would go to the hospital nearest you to ask for a test. When these testing sites, that the state is setting up, when they come to our area, they're being run by an outfit called Optum, and you would go directly to that site. And actually, they ask you to make an appointment. I think it'll be opening up. Those testing sites won't come to our county until late next week, probably at the earliest. And the county is working through, I think, our health department and possibly 211 to set up a way for people to be able to make appointments. I think it can be done online, but some people don't have access to computers. So all of that will get set up. And even when those testing sites come to Monterey County, you'll be able to go to a hospital near you to ask to be tested. I think at the hospitals, they will be maintaining the same criteria now that are being used for testing, and that is really just for people who have symptoms. The tests are, there's not enough testing capacity to just test anyone who wants to be tested. But my understanding is that the testing sites that the state is making available to us here will have different criteria, and so I don't think that you will have to be symptomatic in order to be tested. Let's see, the lab is called ArcPoint Labs. Okay, Well, so I guess there is the opportunity to be tested now. So here's some information. There's a lab called ARC-Point, A-R-C Point, ARC-Point Labs. You can make a reservation online for testing. This person was tested last week, took about 10 minutes. Oh yeah, those are those rapid ones, yeah. And the cost is $175. It's also paid online. The result was given in about 2 to 4 days. So, okay, so the test itself, the specimen taking took 10 minutes, but the results come back in 2 to 4 days. The testing sites that are coming will be able to charge your insurance for the test. And if you don't have insurance, the state will pick up the cost. So that's going to be an affordable option. But meantime, if you want to get a test, it looks like the ARC-Point labs can do it. And you do it all online. So presumably ARC-Point has a website and can tell you where to go and what to do. If people need childcare in order to return to work, there is a website, and I'll tell you what it is, and it is in the chat feature, www.montereychildcare, all one word, .org. So that's montereychildcare.org. Or there's a phone number, 831-757-0775. That's for referrals and support. And also, if you're concerned about being able to afford it, there are vouchers available to pay for childcare for essential workers. And good information. So that information is being put up on the screen now, in addition to the other information sources, including the health department webpage, where there's updated information each day about the number of cases and tests and so on. There's a phone hotline that the county runs, and that number is up on the screen, 755-4521. And then there's an email hotline also, and that is covid-19@co.monterey.ca.us. And any questions about local resources, including if you're thinking about getting more information about public assistance or any of the other nonprofit and community resources, you can always call 211 for information. Oh, I see. Right. So I had a question before about, oh, what does it mean? Question and answer. I just saw it. Okay. Never mind. Okay. Anything else people want to ask about? Okay. Right. So someone is raising the point that FEMA and the state are offering to pay for motel rooms for homeless, this person is saying, but it's not just homeless. It's for people, anyone who lives in a congregate living situation who has tested positive or who has been exposed to a positive COVID person and does not have the ability to isolate in their living quarters. So those motel rooms are available for people for the period of time that they need them. Some cities, this person is saying that some cities are refusing to participate, which puts everyone at more risk. Yes, it does. But I would say that from what I understand, it's not really up to the cities. The relationships have been negotiated between the county health department and emergency operations implementation teams directly with the motels themselves. So as far as I know, I have heard that, there are about 2 to 10 people a week who qualify and who need those resources, and they are being housed in motel rooms, and they stay in place until it's safe for them to leave. So if they have been exposed to the virus and they just need a place to quarantine to find out whether they are going to get sick themselves, that usually takes about 2 weeks to show up. They would stay for that period of time. Their meals would be provided, all very supported. And if it's someone who has the virus and obviously doesn't have so severe a case that they have to be hospitalized for care, once there are protocols for how long they have to be without a fever and without symptoms, and they get tested, checked fever and everything a few times, and they have to be disease-free for some number of tests before they can, or checks before they can be considered recovered. But that's working now. And so I think what I would really encourage people to do is really look at the kinds of things that you need to do. Wendy is putting up the behavioral health website. They have developed an initiative called Forward Together that gives a lot of very useful tips on self-care, on ideas for keeping your kids interested, making sure that you've got the resources you need to help your kids with their schoolwork, be in touch with older members of your family who are at high risk, and you don't want to expose them. There's a lot of helpful information there to keep you informed and not feeling as alone as this isolation can often have us feel. I know for me, I'll go along for a little while just fine, and then something will happen and I react. It's like I just want to take someone's head off for some tiny thing that happens. I can get very, very cranky very, very quickly. And that's when I know, time to add something else into my routine. So I'm sure you've all had those experiences. But the behavioral health website is very helpful with tips. I know there are many, many more. But this strange world that we're living in with shelter in place and physical distancing, it's likely to continue for a while in one form or another. So the more we can develop those kind of self-care routines, you've probably cleaned every closet by now. So, we have to move on to the next strategy. And some of these websites and tips can be helpful because, as I remember when I was a kid, I'd be, kicking around and, I'd say to Mom, what can I do? I'm so bored. And she would come up with all kinds of suggestions like, you could clean your room, you could clean the bathtub, and so then I learned not to ask her. But, my mind would just be blank about what would be a fun thing to do. And so sometimes it helps to have tips, other resources, so that we don't have to rely on our own brains, because sometimes they poop out on us. All right. Well, this has been good. We're getting a little close to the end of our time. And one thing I could do if anyone's interested, so I normally I hold hot topic meetings to talk about the Board of Supervisors agenda. And there is a Board of Supervisors meeting tomorrow, so I could let you know what's going to be on it. We do have in the morning, we do have an update at the 10:30 scheduled time, which doesn't always happen at 10:30, but it won't happen before 10:30. We will be having a briefing and an update on the virus. And usually it's a pretty high level interview. And then there are a couple of key areas that we focus in on. And one is will be the care and shelter plan. So there will be more details about the locations where these, like the fairgrounds, where these housing opportunities for COVID positive folks will occur, and what the timeline is, and so on. And then we're also going to get an update from Monterey Bay Community Power. And one thing that they have done, which you may have seen publicized, is that they have for at least for 2 months, they are either reducing the cost of electricity to customers here in Monterey County and Santa Cruz County and San Benito County. They may be cutting the price in half, or they may be eliminating the cost altogether. I can't remember exactly, but when I get a chance to read the staff report, I will know. But you could always tune in tomorrow and find out. That's pretty much going to be the morning. And then in the afternoon, we have a couple of land use items, a lot line adjustment in the Salinas Valley, and actually very southern Salinas Valley. Looks pretty routine. We are in negotiations with the Waste Management Corporation for garbage pickup in the county, and those negotiations have been going on for a while, and looks like they're going to continue. We're going to be doing a contract extension to allow those negotiations to continue. Then there's an appeal from the Open Monterey project on a lot line adjustment in Carmel. So that'll be an interesting one. So that's in the afternoon. And then another interesting one will be, in Monterey County, we set up a pilot program for the cultivation of hemp. And it's on the agenda tomorrow to extend the pilot program through the end of the year 2022. So it's been going pretty well, and this is probably not a time when people have the bandwidth to think about changing anything like that in a big way. So we're looking to extend it and give people the opportunity to continue to grow hemp in Monterey County. All right, well, I have talked on for quite a time here. You've had some good questions and comments that have been helpful. And if there isn't anything else, I would just say keep an eye out for the face covering order. Should be coming out soon. So in your spare time, find those bandanas, find a cloth face covering or two, so that you can keep some going into the laundry and some being ones that you can wear out there, and continue. You know, in Monterey County, you all have been doing such a great job of sheltering in place, being compliant with all of the, rules and regulations to keep yourself and our neighbors and community members safe from this disease. So I really want to thank you for that. Let's see, there's a question here. In Salinas off of West Alisal, the city removed trees. So yeah, there's a question about whether removing those trees was necessary or not. Yeah, I don't know. I think that question, it really probably is a question for the city of Salinas about whether they thought it was essential or not. And I think this is where, as we go forward and as whenever changes might be made to the shelter-in-place order, rather than calling things essential or non-essential, just having there be criteria about whether we can keep a safe distance. Is probably going to be a lot easier to enforce and for people to understand, and it doesn't have the same kind of judgmental sort of sound. Let's see, we have a question. Will masks be required while riding a bike? In other areas, masks are not required while exercising. Well, we'll have to wait and see what the order says, but my sense is that the masks are supposed to be for those times when you might be interacting with other people. So if you're exercising by yourself, just like when you're in your car by yourself, you don't need to be wearing a face covering. But anytime that you would come into contact, 6 feet or well, not less, because we're not going to get closer than 6 feet to people. But when you would encounter other people, that would be the time that you would want to have your face covered. And probably if you're on a bike, you're not going to get, you can probably keep that 6 foot distance pretty easily. All right, well, I'm going to wrap it up here. I want to thank you so much for tuning in. And I want to encourage you to come back next week at 5:30 for our virtual Hot Topics. I'm sure there will be some development that we can bring you the latest and greatest information on. So take care of yourself, cover those faces, and be safe and be kind to yourself and others. Take care. Thanks so much for being here.